Good afternoon, ladies and gentlemen. Magandang hapon pong muli sa inyong lahat. And kayo po ay lugod na, ako po ay nagagalak po sa inyong sama sa amin ngayong hapong ito. This afternoon, we have another interesting topic. It's about the pandemic skin. So based on our title, That Glow Which Matters. Okay, so we are very lucky and honored to have the Vice President of the Philippine Dermatological Society, Dr. Noemi Salta-Ramos, as our featured speaker for this afternoon. But before that, of course, we would like to thank our friends who continuously support us in this activity, our advocacy projects. We have UAP, Valuing Life, Breathe Freely, Ang Nagmamahal, Natra Farm, What Science Can Do. Of course, thank you very much to AstraZeneca. Okay, so without further ado, I'd like to call our featured speaker for this afternoon, Dr. Noemi Salta-Ramos.
Good day, everyone. First of all, I would like to thank Dr. Jude Giang for inviting me to give this lecture. Today, I will talk about skin disorders related to the pandemic. We dermatologists actually refer to this as SkinDemic. COVID-19 was initially known to cause respiratory symptoms. However, as the pandemic progressed, many atypical features of this infection have been noted. It is now well known that the coronavirus affects many organs, including the skin, whose manifestations are a consequence of the disease itself, as well as the preventive measures taken to avoid the infection. For the next 20 minutes, I shall be sharing with you the various COVID-related cutaneous disorders, both those encountered among the patients and the healthcare workers caring for these patients. Before I proceed, I would like to state my disclosure. I have no conflict of interest relevant to this lecture. I have been requested to discuss the following topics: cutaneous manifestations related to COVID-19, skin disorders associated or related to the COVID-19, and the prevention of pandemic-related skin problems. This will be the scope of our discussion. In general, dermatological complications associated with COVID-19 may be caused directly by infection or occur due to preventive measures applied in this pandemic. Virus-induced skin eruptions are either direct or indirect effects of the infection or the result of drug hypersensitivity, while non-virus-related skin damage can be caused either by personal protective equipment, PPE, or disinfectants. For the first part of our discussion, I will talk about the manifestations of COVID-19 infections on the integumentary system, which is comprised by the skin, hair, and nails. Skin lesions associated with COVID-19 infection has been attributed to the presence of angiotensin-converting enzyme 2, which is the primary receptor for SARS-CoV-2. The virus can directly induce cutaneous lesions or indirectly due to vascular dysfunctions such as vasculitis and thrombotic vasculopathy. Nearly 2 years since its discovery and declaration of a pandemic, there had been overwhelming information and publications regarding this viral infection. COVID-19 related skin findings have received so much attention and have been a favorite topic in research and lectures. Citing local literature, the first report on the skin manifestations of COVID-19 was published in the May 2020 issue of the Journal of the Philippine Dermatological Society. In the article, 2 COVID cases with skin findings were reported. The first one was a 51-year-old male patient with mild COVID who presented with urticarial lesions. The other one was a 49-year-old female who presented with transient bilateral livedo reticularis on thighs and legs. More recently, a group of young Filipino dermatologists conducted a systematic review of clinical and histopathological features of the cutaneous manifestations of COVID-19 infection. Different cutaneous manifestations have been documented in suspected and confirmed COVID-19 patients. Presentations may vary due to the different virologic phases as well as the distinct immune response of the body. Based on the review of several publications from January 2020 up to March 2021, the following are the different clinical presentations of COVID-19 infection on the skin. I will briefly describe each one of them. The maculopapular or morbilliform eruption was the most frequently reported cutaneous manifestation in patients with COVID-19 infection. Lesions were erythematous macules, papules, some coalescing to form plaques. It starts on the trunk with progression to the extremities, with associated pruritus being the most common cutaneous symptoms. Occurring in about 22 to 37% of the patients, these eruptions may appear at the same time or evolve from mild involvement to a more diffuse pattern. These lesions can result from SARS-CoV-2 itself or drugs used to treat COVID-19 infection. They are invariably pruritic and can last up to 1 week. Topical glucocorticoids, or in more severe cases, systemic corticosteroids can provide a suitable remedy. Also known as pernio-like lesions, chilblain-like lesions are the second most common cutaneous manifestations in patients with suspected and confirmed COVID-19 infection, with frequencies of 18 to 25%. These lesions are described as erythematous biolaceous patches or plaques, usually located on the feet, sometimes on the hands, and rarely on the auricular area. They may be accompanied by itching, pain, or a burning sensation. COVID toes are vasculopathy rashes located in acral areas. The eruptions usually occur in mild or even asymptomatic cases of COVID-19 and more commonly in children and young adults. These lesions usually have the most prolonged duration, lasting for 2 to 4 weeks. This was also consistently associated with absent to mild COVID-19 systemic symptoms and tend to subside spontaneously as well. Urticaria was another common cutaneous manifestation. The lesions were scattered wheals on the trunk and extremities, some coalescing to form larger plaques. Itching is almost always present. As with other hypersensitivities and allergic dermatitis, low-dose oral corticosteroids, in addition to antihistamines, can provide appropriate relief. Papulovesicular eruptions also referred to as chickenpox-like lesions. The eruptions were described or scattered small monomorphic vesicles on the trunk with a tendency to coalesce, rupture, and form hemorrhagic crust. Other reports showed localized group vesicles on the trunk with surrounding erythema. The eruption mostly occurred after the onset of systemic symptoms, lasting for about 10 days. The most common cutaneous symptom was pruritus. Next is livedo reticularis pattern. This skin involvement appear as cross-link pattern accompanied by bluish discoloration of the skin. These lesions are first symmetrical and lace-like, resulting from cutaneous vasoconstriction and vascular flow disturbances, and disappearing by themselves. Another variant usually consisted of more oversized, more irregular, and asymmetrical lesions related to focal blood flow disturbances and may be associated with severe coagulopathies. These eruptions are more common in the elderly and patients with severe COVID-19 infection. Purpuric lesions are usually due to vasculitic changes resulting from direct endothelial lesions or exaggerated inflammatory reactions. They are sometimes accompanied by necrotic lesions. Mild cases can be treated with topical steroids, while more severe cases need systemic steroids. Although not classified, ischemic and ecchymotic acral lesions have been reported in almost 10% of the patients, especially in those with severe COVID-19 infection due to hypercoagulation and disseminated intravascular coagulation. This manifestation was consistently associated with severe COVID-19 infection and with a 10% mortality rate. As various medications are being tried and used to treat COVID-19 infection, skin reactions to drugs are common in these patients. Adverse reactions associated with the medication may be immediate or delayed hypersensitivity reaction. They may be present clinically as urticaria, maculopapular rashes, erythema multiforme, vasculitis, or more severe reactions like SJS or DRESS, drug reaction with eosinophilia and systemic symptoms. Hydroxychloroquine is the most common drug responsible for drug eruptions caused by COVID-19. This agent may cause multiple skin lesions like hyperpigmentation, hair whitening, and psoriasis exacerbation. Stevens-Johnson syndrome was also reported in a patient with COVID-19 treated with hydroxychloroquine. Before we move on to hair disorders related to COVID-19, let me share with you some interesting trivia. An 8% increase in Google search for hair loss was noted during the pandemic. And companies selling hair vitamins or supplements noticed a 60% increase in revenue in 2020. Clinically, the impact of COVID-19 on hair has been described under these three categories: androgenetic alopecia, telogen effluvium, and alopecia areata. Increasing interest in androgenetic alopecia as a potential marker for severe COVID-19 infection has been studied. This was referred as the Gabrin sign to recognize the first American physician with androgenetic alopecia who died from severe COVID-19 infection. In one study, it was observed that patients with more advanced androgenetic alopecia had worse hospitalization outcome. The authors hypothesized the role of androgen receptors in regulating transmembrane protease, which primes the binding of SARS-CoV-2 to the angiotensin-converting enzyme 2 receptor. In addition, men have more ACE2 receptors than women, thereby allowing more viruses to bind to these receptors. This could explain the higher incidence of mortality among men, with the difference in the mortality rate of 58% for men and 42% for women. However, this was challenged in a study done in Brazil when they found no evidence linking androgenic alopecia and worse COVID outcome. Further studies are needed to prove the association between androgenetic alopecia and the severity of COVID-19. Alopecia areata occurring after COVID infection have been reported. Alopecia areata is an autoimmune disease in which inflammation and loss of hair follicle lead to non-scarring hair loss. Several environmental factors have been suggested as possible triggers in genetically predisposed individuals, such as stress, viruses, vaccination, and hormonal alterations. Stress is one of the common triggers exacerbating or inducing alopecia areata. Thus, cases of alopecia areata in individuals with COVID-19 could be a consequence of the psychological distress related to the infection. Post-infectious telogen effluvium cases have also been reported after COVID infection. The occurrence of telogen effluvium was similar to any other systemic insults that prematurely convert anagen hairs to telogen hairs. However, the presence of telogen effluvium may also be due to drugs and stress aside from the probable infectious etiology. Let's now discuss nail changes among COVID-19 patients. There were a few case reports which documented nail changes post-COVID-19 infection. A case of Bowes lines described as transverse grooves on both fingernails and toenails that appeared 3 months after COVID-19 infection. Nail changes are due to the temporary arrest of growth in the nail matrix. The red half-moon sign was another nail finding that presented as a transient half-moon-shaped red bands surrounding the distal part of the lunula on fingernails, which is the result of capillary changes to the nail fold bed indicative of microvascular involvement. Moving to the second part of our lecture, let us now talk about skin disorders related to the use of personal preventive equipment or disinfecting measures. The COVID-19 pandemic has resulted in occupationally induced skin conditions in health workers associated with increased hand washing, repeated exposure to sterilizing agents, and increased use of personal protective equipment such as respirators, face masks, and gloves. These skin problems may be brought about by these factors: hyperhydration or moisture retention, friction, epidermal barrier breakdown, and contact reactions. A recent article in the Journal of American Academy of Dermatology presented a worldwide systematic review of 16 online databases on PPE-related dermatosis among healthcare workers from the period January 2020 to January 2021. A total of 3,958 participants were included in the meta-analysis. When the entire cohort was analyzed, the most common affected body sites were the face and the hands. The most commonly implicated cause of occupational contactants were increased frequency of hand hygiene, the use of gloves, N95 masks, and goggles or face shields. The visible signs of PPE-related dermatosis are as follows: cirrhosis or dryness, erythema, papules, maceration, fissures or erosions, vesicles, or pustules. Repeated washing of hands throughout the day, whether with soap and water or alcohol-based hand sanitizers, can result in dried and cracked skin. Dry, cracked skin can cause symptoms of burning, itching, redness, known as irritant contact dermatitis, that can lead to a local skin infection. In a survey of 105 healthcare workers, 50.4% had hand dermatitis. This is something that we are all aware of. Compared with the use of sanitizers, hand washing eliminates a wider spectrum of pathogens. However, please note that both alcohol-based rubs and soaps may cause either irritant or allergic contact dermatitis due to any of these chemicals. In order to identify the causative agent with certainty, a patch test is recommended. Another important information that I would like to share with you is with regards to the activity of the different antiseptic agents versus the coronavirus. High antiseptic activity has been documented with chlorosylenol, ethanol, povidone iodine, sodium hypochlorite, and triclosan. This is another practical advice to minimize hand dermatitis. Do not use sanitizers immediately before or after hand washing, and do not wear gloves while hands are still damp. The moisture and occlusion will enhance the penetration of irritants and allergens and will result to greater risk for contact dermatitis. Healthcare workers should be encouraged to use a moisturizer to protect the skin. Almost all topical moisturizing products available in the market contain a combination of emollients, occlusive ingredients, and humectants with the goals of skin barrier repair and retention of moisture. Ointments in general have the highest percentage of oil, followed by creams and lotions. The ointments have the highest oil-to-water ratio and may stay on the skin longer. Creams are preferred by some people as they are less messy to apply and more readily absorbed. The preferred formulation to use should be based on the skin condition as well as the personal preference. When choosing between different products, look for a product with petrolatum, which is the most effective occlusive ingredient. Studies have shown that petrolatum reduces transepidermal water loss by more than 98%. Here are some additional tips and tricks to optimize the use of moisturizers. Avoid jars since dipping hands into the jar may cause contamination. Use tubes instead. It is also good to have small tubes for frequent application throughout the day. At night, apply moisturizers followed by cotton gloves or even socks. Healthcare workers can wear water-based moisturizer under the gloves. The oil-based moisturizer may break down latex or rubber. For very dry skin, you can try the soak and smear method. Soak in water 20 minutes, and then immediately apply moisturizer of choice nightly. Reaction to gloves may be in the form of contact dermatitis or exacerbation of existing dermatosis. Contact dermatitis may either be allergic or irritant in nature. Comparing latex and nitrile gloves, both may contain allergens and irritants, although you will note that latex is more allergenic. Let's now discuss dermatosis related to the use of mask. An article by Darlensky reported that 1/3 of healthcare workers complain of acne, facial itch, or dermatitis. Among the adverse facial reactions, acne is the most commonly reported, accounting for almost 40% of cases. Pressure-related injuries due to prolonged contact with masks and goggles are usually noted on the nose bridge, accounting for 83% of cases. Like surgical gloves, the different kinds of masks may cause both irritant and allergic contact dermatitis. To avoid strap-related dermatitis, a thin foam dressing behind the ear may be used. Another way is to place the mask strap over the crown of the head and not over the ears. To avoid pressure-related injury, it is important to use the correct size of mask. Petrolatum dressing may be applied 3 to 4 times a day. And if open wound is present, use a hydrocolloid dressing. Nowadays, we are also frequently seeing the acne variant known as masne. The medical term for masne is acne mechanica, which is a skin condition brought on by the prolonged wearing of facial protective gears like mask. Lesions are formed in the areas covered by the mask due to friction, pressure, or occlusion. This is an infographic by the American Academy of Dermatology on how to prevent or manage mask-related dermatosis. The most important thing to do in order to prevent irritation and breakouts is to keep the skin clean and well moisturized. Healthcare workers should wash their face gently but thoroughly using a pH-balanced, non-comedogenic cleanser after wearing masks to remove the oil, dirt, and bacteria. Apply moisturizer immediately after washing, and the use of makeup is discouraged. Another important impact of the pandemic on the skin is related to psychological stress. Social isolation and quarantine can adversely affect many aspects of a healthy lifestyle. Stress and anxiety induced by this condition can lead to exacerbation of underlying chronic dermatosis. The intricate relationship between stress and skin conditions has been documented since ancient times. A relevant link between stress and disease was first described in the 1970s, when it was proven that viral diseases of the mucous membrane, such as the rhinovirus and Coxsackie virus infection, develop faster and more severe after stress exposure. A brain-skin connection with local neuroimmunoendocrine circuitry underlies the pathogenesis of many skin diseases, which are triggered or aggravated by stress. Stressful conditions exert their effects to the skin mainly through the hypothalamic pituitary adrenal axis. The skin also developed a fully functional peripheral HPA system where stress hormones and their receptors are produced in skin cells. These are some dermatological conditions that have been reported to be highly associated to chronic stress. Acne vulgaris, psoriasis, atopic dermatitis, and other eczemas, and aging. So the question now is, how do we manage stress-related skin disorders? The most logical answer, of course, is to manage stress itself. Unfortunately, there is no quick fix or instant remedy for stress. And with the end of the pandemic still nowhere in sight, being free from stress is not going to happen easily. But we should keep on hoping. We should keep on coping. We are all familiar with the inhale, exhale technique of warding stress. And this will definitely help us, not only emotionally and psychologically, but also physically and, of course, dermatologically. Finally, this is one simple but great piece of advice that we should remind ourselves and our patients as we continue to confront the stresses of our daily lives in the midst of the continuing pandemic. If you're stressed, you get pimples. If you cry, you get wrinkles. So just smile and get dimples. Thank you very much for your kind attention.
Thank you very much, Dr. Noemi. Yan. Nakangiti ako. Hi, Dr. Good afternoon. Kita po ba yung dimples ko?
Kitang-kita.
Parang present lahat to. Pimples, wrinkles, dimples, present lahat. So talagang malaki pinagdaanan ng mukha ko, no?
Ikaw talaga,
Thank you very much again, Dr. Noemi, for that wonderful lecture. Grabe. Ang daming terms ngayon na nakukoin. Like yung SkinDemic.
Yeah. Oo.
Masne.
Yeah.
Tapos I think meron din po yata Dr. ngayon cosmeceuticals. parang
Yeah.
may mga gano'n na ako narinig ngayon na mga terminologies po eh. So,
Yeah.
Dr. Noemi, regarding this skin lesions po, there's a question here, no?
Mhm.
Since it may mask other skin diseases, is there a need to do biopsy, or are these lesions talagang pathognomonic of COVID infection?
Um, Alam mo, Jude, I don't think we can say any of those lesions can be called pathognomonic or unique to COVID. As you can see, even the way they are described morphologically. I mean, based on appearance. So,
Okay.
I am not actually aware that anybody has actually said, even the word COVID toes, it's not really, particularly for COVID. It's just that it was found that it was quite common. But basically, the pathophysiology would again be linked to the vascular compromise, the
Yes, oo nga.
hypercoagulability.
Yes.
So they're not really, even the other manifestations like urticaria. So they're very non-specific. So it's very hard to say, that this particular disease would actually tell you that this patient has COVID.
COVID, yes. So, okay. So I think it boils down that we really need to do, no? Complete physical examination, no? Na di natin pwedeng baliwalain yung mga nakita natin, especially sa skin, very ano yan eh, visual, no? Unlike sa lungs, you need to do mga auscultation, no? So, pag nakita mo yung pasyente, nakita, may skin lesion siya. Okay, so you will think as one of our differentials, baka merong COVID na infection, not necessarily pathognomonic of the skin lesion. Okay.
Yeah.
Victoria, there's another question here, no? Regarding alopecia. Okay, parang meron na rin ito. So, di
maraming
naman,
maraming tinatamaan doon sa
oo,
alopecia.
kahit na wala namang COVID, pero because of stress brought about by COVID. Okay, so,
Mhm.
you think yung management daw po ba is the same as yung mga ina-apply? Kasi ngayon, di ba, ang daming, like nabanggit niyo po kanina sa social media, nag-increase yung business ng mga,
Yeah.
ang dami lumalabas ng mga companies about selling these hair products, yung mga nila ginagawang parang lotion, ganyan.
Correct.
So are these effective? I mean, for those patients na who get infected with COVID. Kasi sabi niyo
Okay.
kanina, sa skin lesions, it will disappear once yung treatment is based on dun sa underlying mechanism. No?
Yep.
So what about yung mga ganito po, no, na nasa labas, like alopecia? Yeah.
Actually, even the disorders of the hairs that we have noted among patients post-COVID, they cannot be labeled as being unique. Oo, no, Jude? Kasi like for example, it's very frequent to see telogen effluvium after a bout of a severe illness. We see that very frequently post-dengue, post-surgery, or even postpartum. Okay? So, these are actually non-specific, and basically the management will be the same whether it's related to COVID or not. And having said that, since a lot of this, hair disorders, particularly alopecia areata and telogen effluvium, they have been linked to both physical and emotional psychological stress. Then that would of course be part of the management. But if you will ask me about pharmacological treatment, the only evidence-based treatment for hair loss would still be, for the topical, it would be minoxidil. And then if we're talking of systemic, and this is only for the male pattern baldness, it will be finasteride. Okay, now, you mentioned a while ago about cosmeceuticals. And cosmeceuticals, or the other term for that, would be the dermocosmetic. And this would actually be those products which are not, what do you call that? They're not considered drugs. They're actually somewhat midway between a cosmetic and a drug. Okay? Para, that is just to make it simple. And we have a lot of that, especially not only for the skin, but for the hair as well. And I will cite to you some, of course, this is not in any way to be viewed as an endorsement, but you're familiar with Novo Hair, you,
Yes,
you
oo.
know,
Ang
yeah.
mahal.
But yes, and they're quite expensive. But again, you will see that they would usually put their no approved therapeutic claims.
Claims, yes.
Of course, when you see no approved therapeutic claims, that means it's not a medicine. It's not a drug. So if a patient would ask me, Doctora, okay ba to? Can I use this? And then I would just say, matter of factly, it's not a drug and there is no approved therapeutic claims. Oh, okay. So para bang take it at your own risk.
Yes, yes.
Okay. But of course,
Kung
I will not deny the fact that there are some testimonials. But as you know, we consider testimonials as the weakest form of evidence.
yes. Oo, sa mga ganito, 'di ba, doktora, may mga celebrities na nag-endorse,
Yeah,
'yan, 'di ba?
exactly.
Oo, oo. Kaya
Yes.
yung consumers natin, so they tend to siyempre bibili, "Ay, ginamit ni ganito, ginamit ni ganito." So mukhang effective, ganyan.
Yes, yes, of course. But as doctors, of course, naman, Jude, yung sinasabi nating evidence-based
Case,
dapat
yes.
ang ating ano.
Doktora,
Okay.
aside from, I mean now, kasi like most of us are, work from home, ayan.
Yep.
So, yung long hours of exposure sa laptop, ayan. Meeting, parang
Yes.
ayaw nilang matulog, di ba? Parang gusto laging
Oo.
sa meeting. O magmi-meeting gabing-gabi. Or yung mga students, mga students natin
Yeah.
ngayon nasa computer, no, para dahil sa kanilang online classes. So, may epekto rin po ba yung doktora, no, sa skin, no? Will it accelerate aging sa mga age group ko?
Talagang age group mo, Jude, ha? Okay. That is also a question that I ask myself. So I really try to read about that, no? So because a lot of patients would ask, Doctor, do I still need a sunscreen? Because we always advocate the use of sunscreen pre-pandemic, no? We always say you're never too young to use a sunscreen because sunscreen is the main culprit for the aging, no? Okay, we call it photo aging. So the question now is during this time of the pandemic when almost, as you have mentioned, almost everyone is just staying home, working from home, and then it's just but constantly exposed to gadgets, no, radiation from the laptop, from the gadgets, from the television. So now there is really there were some studies about the blue light. They're saying it's not it's of course it is going to be detrimental for the skin, even the eyes, they say. Kaya di ba yung iba ina-advocate na rin nila ng mga well, I don't know if it's the ophthalmologist or the optometrist who's actually recommending yung anti-radiation di ba lens. And then they say even for the brain, that's why it is being discouraged that you expose the children, the very young children, to this kind of gadgets. But having said all of that, I would still now advocate, because that is, of course, I would consider it an indoor source of radiation, much
Okay.
like the fluorescent light and the other source of light. It would still be best to have sunscreen or UV protection. So I would just say it's UV protection. Hindi ko na sinasabing sunscreen, just to be very accurate about it. If you will ask the dermatologist, do we still recommend that you put UV protection even if you're staying indoors? We would say yes.
Okay.
Personally, I would say yes because of that reason.
Okay, so lalo na ngayon, no? So, Doktora, yung regarding the UV protection, will it be the same? Yung, di ba may mga numbers siya? Will
Yeah.
it be the same yung ginagamit outdoors? Or is there a minimum, what do you call this? Parang
SPF.
number? SPF, yung
Sun
SPF.
protection factor.
Yes,
Okay.
oo.
Ganito yun, Jude, no? Kasi yung sun protection factor, usually they say, kasi we have this impression that the higher the number, the better. But that is not
Yes.
very true. Because they say, it was studied that the difference between an SPF 30 and an SPF 50 is not, the protection is not much. What is very important is that it has to be a broad spectrum. That's one. It has to cover for both UVA and UVB. That's very important. Okay? It should be able to, of course, prevent aging, but prevent skin cancer as well. So we have to address that. Now, the other thing is, it's also important, if you would ask me, what is the minimum SPF? Normally, it would say SPF 15 should be enough, but in our country, where it's very humid and we sweat a lot, okay? So, of course, a significant amount of the sunscreen that we have applied would probably be, will go with the oil and the sweat, and you would,
Yes.
occasionally you wipe your face with Kleenex, with tissue, so I would say at least 30 SPF
30.
30, yeah, for daily use. I don't see any distinct advantage of using an SPF 50 or an SPF 100. It gives you a false sense of protection, but it doesn't really offer a great advantage. Again, another important thing about choosing your sunscreen, Jude, would be you have to choose the one that is appropriate for your type of skin. Because if you're very oily and you get those sunscreen that are very sticky, so it may even clog your pores, and it can lead to breakouts. And remember also, there is also a high incidence of allergy to sunscreen because of all those chemicals there. And the higher the SPF is, and it's most likely that it has a lot more chemicals. Now, if the patient has very sensitive skin, and also for the younger population, we prefer to give what we call the physical sunscreen. The physical sunscreen containing titanium oxide or the zinc oxide would be preferable for children and also for those with very sensitive skin. No chemicals.
No chemical.
Ang disadvantage lang nun, Jude, sila yung medyo parang maputi. Yung yung ayaw yun ng iba, doktora, para akong So, yun lang. Oo.
Okay. So yan, titanium siguro bagay sa akin.
Pero
Yeah.
meron na rin kasi naman yung skin color. Meron na rin
Okay,
naman.
so
So,
nagbi-blend na
parang,
siya sa skin.
yes.
Yes. Doktora, so before magmi-meeting, halimbawa, no, dapat maglalagay na tayo ng skin protection. Kasi in relation to that, no, meron daw po bang time, gaano katagal ma-expose sa computer or laptop, nag-start na magkaroon ng problem sa skin?
Usually, Jude, kasi yung mga effect ng radiation sa skin natin, cumulative yan. Mula
Okay.
yung exposure natin mula pagkabata.
Bata.
They say nga, the aging of the skin actually starts at the age of 25.
Naku,
But,
lagpas na ako.
lagpas ka na, 26 ka na, Jude.
Oo.
But it does not, of course, hindi siya visible until we reach a certain age, no? So, depende rin kasi dun sa lifestyle mo. If you're constantly exposed to the sun, syempre, you tend to have more wrinkles, di ba? Kaya nga,
Yes.
the best form of anti-aging would still be the sun protection. Oo.
Okay.
So, ganon. Now, you're asking, what is the best, okay, this is what we always say. Whether you are going to be exposed to the sun or you're avoiding the radiation emanating from your gadget, you should be applying the sunscreen or the UV protection at least 30 minutes before exposure. That's
yan,
it.
Thank you. Joanne, 30 minutes.
Before.
Before. So before any meeting or activity. Ayan, we have a lot of questions, pero i-screen ko ba? Iba kasi para nagkukonsulta eh.
Pwede naman. Kaya lang, yan, i-discuss natin yung mga personal,
Oo nga eh. Okay. Our beauty and personal care products safe to use during the pandemic?
Well, the answer would be, it depends. What products are we talking about? Yeah, I think, if there is one thing that this pandemic has taught us, it is actually, we have to go on with our lives, 'di ba? hindi naman porke nasa bahay ka na lang, pabayaan mo na yung sarili mo.
Yes.
Sasabihin mo, ay, hindi na ako hindi na ako mag-apply ng moisturizer, hindi na ako mag 'di ba? And then
Yes.
it adds to your because when you looking good, also you know this, 'di ba? Pag it also adds to your um your sense of well-being,
Yes.
kasi pagka pandemic na nga, tapos pababayaan mo pa yung sarili mo.
So
Saan ba
ngayon,
nauwi doon? Ang tanong kasi yung products, no? But the products would, whether pandemic or not, of course, the guidelines in choosing your products would depend, of course, on the ingredients. You have to, of course, the best. Sorry, I have to tell this that, of course, ideally, you should ask the dermatologist.
pathologist, yes.
Oo. Ay,
Okay.
hindi naman sa ina-advertise ko. But I'm sure you have friends who are dermatologists, who are members of our organization, and
Yes.
you can always call them.
Okay. Masyado nga naman broad yung products.
Oo.
Marami kasi eh.
Oo. Marami. Marami.
Marami. Ito siguro. What's the best way to soothe the pandemic skin?
Ang nakikita ko kasi, ang common na kulang ngayon sa lahat ng tao, sun exposure. Alam mo, you don't have to, eto nga yung isang importante na kailangan ng balat natin, libre. Pero,
Sunlight.
yes, kailangan, hindi lang nga ng skin, di ba, Jude?
Yes.
I mean, kailangan ng buong immune system. Sabi ko nga, yan yung in abundance. But what do we do? Nakakulong tayo lahat sa loob ng bahay
Yes.
natin. Well, whether intentional or unintentional. Yung iba naman kasi, talagang wala naman silang way, yung wala sila talagang enough space, no? But I will always tell this, even for non-dermatological patients, no? I don't fail to advise them that you have to, all of us would need to have moderate amount of healthy sun exposure. Emphasize the healthy sun exposure kasi syempre hindi ko naman kayo palalabasin ka ako ng alas 10 ng umaga hanggang alas 3 ng hapon. Oo, of course you know what I'm talking about. That would be about 6 to 9 in the morning.
Yes.
15 to 20 minutes sun exposure. That will, kasi if you would remember, Jude, when you were studying dermatology, di ba, pag mayroong mga generalized skin problem like eczema, psoriasis, they advocate that if the patient cannot go for the phototherapy because there's really, di ba, meron tayong yung photo, yung mga narrowband UVB, ganyan, yung mga controlled. Most of the institutions, the big hospitals would have that. Pag may psoriasis ka, papasok ka dun sa chamber, di ba?
Yes.
Ganon. However, sinasabi ko nga dun sa mga pasyente who do not have the time, who cannot really come, kasi medyo matoxic din yun no? Minsan, kasi ang bilis-bilis lang ng exposure mo, sabi ng pasyente, doktora, minsan 15 minutes lang ako i-expose, pero yung traffic papunta, pabalik.
Mas matagal.
Tagal. So I would say, nandyan ang haring araw.
Okay.
Yan ang gamitin mo.
Gamitin natin, yes. By the way, yung office po ng PCCP malapit lang sa office.
Kapit-bahay pala tayo. I was
Kapit-bahay lang
looking.
po. So, ayan
73
po.
kami. 73 Malakas.
Yes.
Parang yung Pogs din yata nandyan
Yes. Nasa kabilang side naman po yung Pogs. Ayan. So, pwede po tayong pumunta.
June, pag nandun ako, sasabihin ko sa'yo. Magkita tayo.
Thank you very much, Doktora. Okay. Ito, meron pa isang magandang question dito Okay. Is there a need daw po, Doktora, or what is the real indication for the use of shower gel and bath gel during this pandemic?
Actually, basically, yung these are, of course, cleansers, di ba? Much like soaps. They only come in different formulations. So, di ba, minsan soap bar, liquid, tapos meron pang foam, cleanser, tapos may gel. Again, I think it's a matter of personal preference, which one you like. Ako personally, I like the liquid soap, yung mga ganon. Merong iba, mas gusto bar soap, di ba? Again, the more important issue there would be the ingredients.
Ingredients
Ang
pa rin
kanina
talaga.
pinakita ko, di ba? Because there are certain products that are that have a lot of allergenic substances.
Yes, oo.
Oo.
Okay.
Let me just that now that we're mentioning this soaps and it's no secret that a lot of dermatologists would recommend Dove sensitive. Kung medyo alam nyo yan sa mga kaibigan
Yes.
nyo. Na ano ba yung mga dermatologists na yan? Mga ano ba yan? Endorsers ba yan ng Dove? I have an explanation for that, no? And this is again not to be viewed as an endorsement for that product. Ganito kasi, ideally, the best cleanser would be something that is pH balanced. Yeah, I mentioned that. Of course, you know that the pH of the skin is a little on the acidic side, but it's about 5.5 to 6. Okay, kaya nga may yung sa OB, I think there is a debate about that kasi yung mga feminine wash, ano ba talaga? Yung acidic ba dapat o yung 5.5 ang pH, no? But anyway, as far as the skin is concerned, a pH balance would be somewhere in that range, 5.5 to 6. Now, your usual soaps, bath soaps, no? I will mention a brand and again, hindi naman ito example, Safeguard. Okay, the pH of those kinds of soap, Lifebuoy, yung mga ganyan, no? Is about 9. They're alkaline. Okay. So, kung hindi naman sensitive yung skin mo, that's fine. Wala naman tayong problema doon, no? And if they contain germicidal contents, may mga triclosan sila, then that's okay. But again, reminding you that there are some people who are allergic to those. Now, as to the pH, the ones that are available in the market that are pH balanced, I will tell them the brand, yung mga Dove, yan ang Cetaphil, mga Physiogel, mga gentle cleansers, and others na pag nakita nyo, so if you have sensitive skin, better get the pH balance. pH balance. So pag may mga skin irritations na, we prefer to give them.
Okay.
Not because they will cure the condition, but they will not aggravate the condition.
Okay, ayan. So, coming from the expert mismo, kitang-kita naman natin, no? Ang skin ni Doktora talagang smooth. Sa akin, rough. Okay.
Jude, ikaw talaga.
Going back to the soap, nagiging fruit cocktail na po ang mga sabon natin ngayon. May papaya,
May koji.
may avocado. So, what's your comment about that? May mga may question dito about yung mga soap na merong mga papaya flavor ba yon or avocado
okay,
flavor?
I will explain. I'll talk na lang, not specific, no? Lahat na lang. A lot of these are whitening, Jude. Tandaan mo.
Mm-hmm.
Yung mga nagsulputan ng mga yan, when I was doing my residency, sikat na sikat nun yung papaya. Tapos ngayon, itong generation na to, mas sumikat yung kojic.
Yes.
Oo, babae, lalaki, kojic yan. You know, the thing is, Philippines is a country obsessed with whitening. We equate beauty with being white.
White.
Oo. Yun that's the sad thing eh. And isipin natin, paano ba nagwo-work itong mga papaya soap, kojic? Okay. Ito yung isa this is just one of their actions, no? Of course, the others would, of course, has some, like for example, kojic has something regarding the formation of melanin, may action siya doon. But one of their actions also, being acid, no? Lahat sila acid. Yung pag sensitive ang skin mo, yung extreme pH hindi advisable. Pag masyadong acidic, hindi rin. Pag masyadong alkaline, hindi rin. Kaya nga dapat pH balance. So, itong mga other side naman, kojic, papaya, okay, so may acid. One of their action is that they enhance the desquamation of the skin. So, initially, pag bago mo yung ginagamit, may kinis effect eh. Kasi na-exfoliate, that's the word. na-exfoliate yung dead skin, the stratum corneum. So, you reveal the younger and the better looking skin. Okay, wala naman tayong problema dyan, no? So, nag-improve, sasabihin sa'yo ng pasyente, pumuti talaga ako. However, you continuously use that and without proper moisturization, without proper sun protection, you make your skin very sensitive na kasi nawawala na yung natural layer of protection.
Okay.
So, there is such thing as cumulative chronic irritant contact dermatitis. Medyo mahaba, no? Simply put, kasi minsan sasabihin ko sa pasyente, anong sabon ang ginagamit mo? Alam mo, madalas ang sagot, Jude, hindi na sasagot, ay, doktora, matagal na yung sabon ko. Ano nga? Oo, ayaw
ayaw sabihin.
Kojic, doktora, pero 3 years ko nang ginagamit yan. Okay. And that is the perfect scenario. You know, even my own sister, inaway pa ako. Hindi raw yun ang cause nung irritation ng skin niya. But it can be cumulative, Jude.
Okay.
So yun. So how do we prevent that? Hindi ko sinasabing masama ang Kojic. If you're getting good results with that, fine. Wala tayong problema. Pero no, be mindful of yung i-prevent the possible side effect. And how do you do that? One, you use moisturizers immediately after bathing, immediately. And then secondly, sun protection. If you know that you will be exposed to the sun for long hours, then definitely put on sun protection. And then, yung ibang pasyente, sinasabi ko, i-rest nyo yung skin nyo. If you're feeling na parang nagtatight na siya after nyo maligo, nangangati kayo, ipahinga nyo muna. No? Or don't use that Kojic or whitening soap every day. I-rest nyo lang. So, observe. And then, if you put it back, at nagkaganon pa rin, say goodbye na to your whitening soap. Oo.
Huwag nang umasa na puputi pa, no?
Correct. Oo.
Baka talagang yun na yung kulay.
Oo. Alam mo ako kasi, pag sinasabihan ko yung mga pasyente na, minsan nile-lecturean ko, sabi ko, alam mo, ang maganda naman yung skin mo, yung ganon-ganon, I would practically sort of, hindi ko naman dinidiscourage, pero I'm not encouraging whitening. I remember one patient telling me, so doktora, hindi ka pala naniniwala sa mga whitening. Sabi sa akin, I prefer a healthy skin over a white skin, sabi ko. Sagot ng pasyente sa akin, kaya pala hindi ka kaputian, doktora. Aray ko, sinabi talaga sa akin yun. Alam mo, natulala ako doon. You know, that was the most unforgettable one of nung medyo bata pa ako noon. Pero you could just imagine how shocked I was with that. Kaya pala hindi ka kaputian, doktor.
Okay. Doctor, there's a question here sa chat box natin. Good afternoon po, Doktora. Since the pandemic started, I noticed that my hands started drying out because of frequent hand washing and disinfection. So how can we prevent, or what products can be used to prevent the irritant contact dermatitis most healthcare professionals experience nowadays? Kasi parang, I agree, no? Parang pinagliligo na natin mga yan eh.
Correct.
Especially pag magra-rounds ka, rounds ka sa COVID ward or sa ang ward, parang iyaano mo na yan, no? Gagawin mo na siya. Papahid mo na sa buong katawan mo, para na siyang perfume.
Hindi, tsaka lagi meron ka na sa bag. Dati naman hindi, di ba? Meron ka na sa bulsa. Ngayon, nauso pa yung nilalagay, yung nakahook na dun sa mga susi mo sa lahat. No? So, parang okay. I don't know if she was, whoever asked that question, I talk lengthily about hand dermatitis. But anyway, I'll repeat it, don't worry. Talagang hand dermatitis is one of the most common, if not the most common problem that we encounter dun sa tinatawag na PPE related, no? Okay. So we find this very frequently among health workers. Hands and face, yun ang pinaka-problematic, no? So how do we prevent? I mentioned a while ago, of course, between washing and using antiseptic, we prefer, of course, washing, no? Of course, I explained a while ago that we cover more pathogens, we eliminate more pathogens by washing. However, because of the of course, hindi naman laging available mag-wash, no? So we have to use those antiseptics. Now, the idea now is because it's actually impossible naman for us to be removing, minsan nga pag nag-duty, lalo na yung iba, di ba? Mula umaga, gabi na uuwi.
Uuwi.
So ang sinasabi na lang namin, if that is the scenario that you cannot be applying moisturizers, no, yung frequently, kasi kung nasa bahay ka lang, I would say, let's say off ka naman, you're not going to the hospital, you're staying at home. I would say every time after you wash, you put moisturizers immediately, right after. If I may be very specific, we say within 3 minutes. Yun yung golden period, no?
Okay.
Yeah, within 3 minutes, lagay ka agad. Oo, because you want to seal off the moisture, no? Because your moisturizers contain, as I mentioned, occlusive, humectants, and emollients. Iba-iba yung action nila. Yung isa, of course, occlusive, we know, di ba? Kung paano yung i-occlude niya para yung moisture matrap inside. When you say humectants, siya yung nagdodraw ng moisture from the environment and from your skin din, dun sa ilalim, dun sa deeper layers. And then emollients, of course, that is to soften naman the skin. Most of the products that you have in the market, combination naman sila. Oo, you have those three. But of course, the problem is, paano kung, doktora, paano? Maghapon naman ako sa ospital. Nurse ako, maghapon ako 8 hours or more, 10 hours, 12 hours Ang sinasabi namin ganito, pag uwi mo sa bahay, mag-wash ka na, you know the cheapest and yet very effective, petroleum jelly. Petroleum jelly. Anyway, matutulog ka naman and you can put, kung gusto mo, put cotton gloves. I mentioned that a while ago. Oo. For very dry, meron sinasabi, yung pwede ring yung isoak mo muna for 20 minutes sa water, tapos tsaka mo ilagay yon. Tapos, oo. That's the cheapest and very effective. Oo. And you can do that habang natutulog ka.
Okay. No? So I think this pandemic really brought us a lot of ayoko naman sabihing problems di parang mga challenges, no? So yung mga nagkaroon ng infection, tapos yung mga nag-take care ng mga patients. So no? In order to protect ourselves, meron ding effect na nangyayari sa skin natin. Okay? Especially, doktora, no, aside from yung sa hands, yung sa face, no, especially the one using the N95 mask, the bridge of the nose. Kaya yung iba hindi na raw matangos yung ilong nila.
Correct.
Iba daw nasayang yung pinatawag, may nilagay dito. Napa-flatten na daw. Rhino-plasty. Napa-flatten na daw.
Yun ang as I mentioned a while ago in my lecture, it's usually the bridge of the nose, yung nagkakaroon ng pressure related.
Yes.
Lalo na yung mga, of course, those talagang directly handling the COVID patients. Of course, they are, alam mo naman, tinitipid natin yung mga PPE.
Yes,
So talagang So the way to prevent that, ang sinasabi nga namin, again, the very cheap yet very effective, pagka nagtanggal na ng mask, pag-uwi, wash, again, pH balance, tapos put moisturizer all over, and then dun sa mismong spot, kung walang break yung skin, pwedeng petroleum jelly.
Okay.
Kung wala pero kung may break na yung skin, kailangan na ng mga dressing talaga.
Dressings na, okay.
Yes.
Hindi pa naman plastic surgery.
Hindi pa naman.
Doctor, you mentioned something a while ago about skin aging. So, you mentioned about exfoliants and redensifications.
Okay. Yung ganito, kasi laging tinatanong, what is the best anti-aging regimen, if I may
I think yung question nito, feeling niya siguro with the pandemic, mas napabilis yung skin aging niya dahil sa stress. Baka dahil sa stress.
Well, I mentioned a while ago that aging of the skin could also be brought about by the pandemic stress. Oo, meron talagang explanation. Actually, in the lecture that I gave for the PMA, I tackled more the effect of stress, no? I explained it dun sa skin. I did not talk about yung mga COVID manifestation. So talagang meron. It can really stress can aggravate pre-existing skin problems like atopic dermatitis, eczema, psoriasis, yan, highly linked yan. But then aging is also one. Now, how do we, with or without the pandemic, medyo simple na, the standard recommendation would again be one, UV protection, di ba sinabi ko na, yun yung
Yes po.
pinaka-importante. Because the aging of the skin, much of it is because hindi naman chronological aging, Jude, eh. It's really yung exposures natin. So makikita mo, you will notice, of course, this is with due respect to our farmers, yung mga
Yes.
those whose occupation would require them to be under the sun for long hours. You can see medyo marami talaga silang mga wrinkles, no? Oo, and that only means how the UV affects the skin as far as aging is concerned. So, number one, to of course prevent accelerated aging, sun protection or UV protection. That's very important, no? Number two, the use of antioxidant products. Like for example, ngayon naman lahat naman tayo we're into vitamin C na meron systemically, that's good, but then meron din kasing mga skincare products na vitamin A derivative, Jude, yung mga retinol, tretinoin.
Okay,
Oo.
yes.
O yan, exfoliant din sila. Actually, vitamin C, siguro, naririnig nyo naman, very popular yung vitamin C serum.
Yes, so yan ba yung mga Korean products?
Actually, hindi naman Korean lang, pero marami din local. Yung mga sumikat yan kasi nga yung the basis, yung being an antioxidant, no?
Okay.
So, antioxidant, alam na natin kung ano rin yung effect niya, 'di ba? So, ayun, sun protection, antioxidants, moisturizers, of course, importante. And then yung yung sinasabi kasing exfoliant, maraming klaseng exfoliant. Pwede kasing product-based, pwede din procedural. Oo, yung exfoliant meaning you remove the stratum, the dead skin layer. 'Di ba yung uppermost layer of the skin natin? Kasi dead skin yan eh, no? That's the old skin. So yung principle nung chemical peeling, diamond peeling, naririnig niyo yan, 'di ba?
Yes.
Even laser peel ngayon, yan. The principle is just you're trying to remove lang in a controlled manner the upper layer of the skin. So you don't do that parang too frequently then because it can be harmful, no? Yung mga yung iba sasabihin, ay nagpapa-diamond peel ako doktora every week. You must remember that the epidermal cell turnover takes 30 days.
Days.
Pag ginawa mo yun, maaagad. At tama ba yung term ko?
Maagnas.
Masosobrahan ka naman. Oo, kaya dapat sakto lang, sabi nga.
Yes.
Wag sobrahan.
So, I think it's really very important, Dr. Noemi, to really take good care of our skin. Siyempre, di ba? Ito yung nagbibigay ng impression na pag may kausap tayo sa meeting, di ba? Ay, maganda ng skin niya, no? Siguro. Yeah. So, I think it's important talaga na we take good care of our skin, no? Kahit na even during this pandemic. Okay, so yung mga simpleng measures na diniscuss nyo kanina about petroleum jelly. I think hydration din, di ba? Water din. It can also help, no? Very very important, no? I think my last question, Doktora, kasi yung iba medyo related din sa na-discuss nyo na kanina, is about laser, no? Is it a good way to rejuvenate the skin? Parang related yata to sa answer nyo kanina. Okay.
Yeah, of course, we're in the day and age of lasers, but I'm not going to say that laser would be a what you call this would be the front, the first line.
First line.
No, never. I would always say we go by, para ring naman kahit anong condition, there's a step ladder approach.
Yes.
Hindi naman pwede. At saka minsan kasi, Jude, what we encounter, no, because I have a laser center, no, my personal clinic, no, and then sometimes we will get some patients. These are unrealistic expectations which we have to address, no. They are so used kasi yung mga inaga-advertise, may mga artista, ganon. Minsan dadating, doktora, gusto ko yung skin ni Lisa Soberano.
Gagayahin.
Gagaya. Parang gusto kong sabihin, kung alam ko yan, sada Liza Soberano
Una
na
na
ako
ako.
ngayon. Nauuna na ako dyan, di ba? Of course, hindi mo pwede sagutin. But ang problem, very unrealistic ang expectation ng mga tao sa laser. Akala mo magic wand ni Harry Potter.
Yes.
Na kapag kasi medyo mahal ang laser, di ba? Talagang libo yan pagka nagpa-laser. No? Mahal naman kasi yung laser. But then, ang nangyayari, because it's expensive, they expect parang magic. Na parang may mga acne scars, akala nila pag ni-laser, parang eraser. Hindi ganon. So, it's good as an option for rejuvenation. And again, there are different kinds of lasers, like we have CO2 laser, Q-switch and diag laser. The dermatologist will determine which one is, suitable for your specific problem. So when a patient comes to me, I would ask, what is it that concerns you? Oo, kasi minsan, yung akala sa pananaw mo bilang doktor, ito yung concern. Hindi naman pala yun ang concern niya. Di ba?
Yes, opo, yun. So, I think it's very important to prevent further mga skin problems. So it's better to go to your dermatologist and get the correct professional advice rather than, kasi ngayon sabi niyo nga kanina, Tora, no, when you do mga dear Dr. Google lahat no, so kung ano-ano mga ina-apply dyan, nagmumukha yan, may mga fruit salad na nasa face nila, yung mga iba-ibang mga products nandiyan na.
Alam mo, Jude, tomato, carrot, calamansi, lahat na lang nilalagay nila sa face nila.
Yes.
Tapos, we get a lot of irritant contact dermatitis talaga.
Okay. So, yung ba reversible pa?
Unfortunately, sometimes merong hindi.
Ayan.
Okay. Lalo na yung yung nag-hyperpigment.
Na.
Oo, minsan hindi na namin ma-reverse.
Okay, so that's the problem. Okay, so before I end this session, I'd like to shout out to our Dean of the Faculty of Medicine and Surgery, Dr. Odette Maglinaw. Okay, nanonood siya ngayon sa Facebook Live.
Ay, good afternoon po. I am buti ngayon ko lang narinig, kundi na-stress ako kanina. Alam mo naman, pag nakarinig tayo, ay, andyan si Dean. Naku, si Dean, nandyan.
Nanonood siya ngayon sa Facebook Live. Yeah. Thank you very much, Dr. Noemi.
Ay, tapos na. Gusto ko pa.
Ay, gusto pa. Okay.
Hindi.
Thank you daw po, sabi nung nag-question about the hand irritation.
Yes.
Okay. Thank you very much daw po. Kasi ok daw siya ngayon simula ng pandemic, so parang mayat-maya talagang
moisturizer.
Ng alcohol. So ngayon alam niya na kung anong gagawin.
Kasi nga during the day mahirap mag-moisturizer. Ang pwede talaga natin gawin yung sa gabi.
Okay, so the best.
Ibab. Sabi ko nga, malagkit lang yan, pero
matutulog naman na
Oo, correct.
Matutulog naman na. Okay, thank you very much, Dr. Noemi. I hope meron tayong part 2.
Ay, talaga? Sige,
part 2.
Anytime.
Ano na to? Ibang naman to, beauty enhancement naman.
Oh my God. Kailangan imbita tayo din ng iba. Ikaw talaga. Parang hindi na yata ako pang beauty.
Excited yung aming mga staff pupunta sila dyan sa may office, so magtatanong dyan sa may PDS office about...
alam mo, kailangan sabihin nyo kasi right now, puro yung staff yung nagpupunta kasi nga diba? We're not going there regularly.
Ayan. So, ayan mo, kapitbahay, magkakapitbahay lang tayo, Doktora.
Correct.
Okay.
Pag
So,
hindi na pandemic, dapat mag-party tayo.
oh, yes,
Sama-sama.
Doktora. Yung mga magkakapitbahay.
Correct.
Okay. With that, thank you very much, Dr. Noemi. Thank you very much for that ating a wonderful discussion on COVID-19 skin manifestations. Okay, and of course the pandemic-related skin disorders. Okay, so again, thank you very much to all the participants. Okay, for all the PCCP members, and then of course the non-members who join this Usapang Lang this afternoon. So before I end the session, I'd like again to thank our friends from UAP, Valuing Life, Breathe Freely, ang Nagmamahal Natra Farm, What Science Can Do, AstraZeneca. Okay, so I think, Joanne, we'd like to invite them for our next Usapang Lang. Okay, so abangan nyo na lang po yung mga announcement namin. Okay, so sa November, meron na naman po kami isang exciting topic, no, sa Usapang Lang. So thank you very much once again. Stay safe and take care.
Our world continues to struggle with the challenges brought on by the pandemic, new emerging diseases, and climate change. Now more than ever, we recognize the importance of pulmonary health. The PCCP joins the Forum of International Respiratory Society in observance of World Lung Day. Our advocacy has always been towards caring for the lungs by encouraging vaccination, exercise, smoking cessation, and caring for our environment. And so, as we get a little help from our friends, let us all unite, start a conversation, and create awareness of the importance of pulmonary health for a better future.
What would you do if I sang out of tune? Would you stand up and walk out on me?
Lend me your ears and I'll sing you a song, and I'll try not to sing out of key. Oh, I get by with a little help from my friends.
I get by with a little help from my friends. I'm gonna try with a little help from my friends.
What do I do when my love is away? Does it worry you to be alone? How do I feel by the end of the day? Are you sad because you're on your own?
No, I get by with a little help from my friends. I get by with a little help from my friends. I'm gonna try with a little help from my friends. Do you need anybody? I need somebody to love. Do you need anybody? I want somebody to love.
Oh, I get by with a little help from my friends.
I'm gonna try with a little help from my friends.
Oh, I get by with a little help from my friends.
It's easy. Love, love, love. Love, love, love. Love, love, love. Nothing you can do that can't be done. Nothing you can sing that can't be sung.
Nothing you can say, but you can learn how to play the game. It's easy.
Nothing you can make that can't be made. No one you can save that can't be saved.
Nothing you can do, but you can learn how to be you in time. It's easy.
All you need is love. All you need is love. All do do do